9 silent kidney disease symptoms that show up on your skin. Imagine looking in the mirror one morning and realizing your skin suddenly looks different, dull, itchy, or lifeless. For people with stage 3 or higher kidney disease, this isn't just aging. It's your body's signal that your kidneys are overwhelmed. Toxins that should leave your body through urine begin coming out through your skin instead. In this video, you'll learn 9 silent kidney disease skin symptoms that expose kidney stress and what to do about each one. Stay till the end for a powerful bonus. Let's begin with something that feels harmless but signals deeper trouble: persistent dryness and flaking. When the skin starts to feel dry, rough, or flaky even after using moisturizer, it can often mean something deeper is going on inside the body. People with stage 3 or higher kidney disease often experience this because their kidneys are no longer removing waste effectively. When those waste products, especially urea and phosphorus, stay in the blood, instead of being filtered out, they begin to pull water from the skin. This constant fluid loss leaves the surface tight and dull. The oil glands that normally keep the skin smooth also stop working properly when toxin levels rise, which makes the dryness even worse. Many people think it's just aging or cold weather, but persistent dryness without an obvious reason is often one of the first visible signs that kidney function is declining. Research from Cleveland Clinic shows that patients with higher levels of urea in the blood have greater moisture loss through the skin. This happens because urea attracts water from the deeper layers of the skin to the surface, where it evaporates quickly. The body then becomes caught in a cycle where it keeps losing hydration but cannot replace it fast enough. The dryness is not just uncomfortable, it also makes the skin more likely to crack and itch, increasing the risk of infection. Have you ever noticed how dry your skin feels right after a long shower or bath? That is because hot water strips away protective oils, and for kidney patients, that effect lasts much longer. Simple steps can make a real difference. Applying a ceramide-rich moisturizer right after bathing helps trap water in the skin. Choosing foods high in omega-3 fatty acids such as salmon, chia seeds, or flaxseed can reduce inflammation from inside and support natural moisture balance. It also helps to take most of your fluid intake earlier in the day, so your body stays hydrated without increasing nighttime urination. These actions may sound small, but they help restore the skin's natural barrier and reduce discomfort caused by toxin buildup. Now, we move to something that most people find even more frustrating: an issue that can disturb sleep and cause constant irritation. It is time to focus on itchy and irritated skin, the next common symptom linked with declining kidney health. Before we continue, tell me what skin changes you've noticed since your kidney disease reached stage 3 or above. If you're trying to understand and manage these skin signs naturally, make sure to subscribe to Kidnease and turn on the notification bell. And if this video helps you, type 1 in the comments or 0 if it doesn't. Your feedback helps me create even better videos for you. Chronic itching can feel like the kind of irritation that never gives you peace. For people living with stage 3 or higher kidney disease, that constant itch is not just on the surface. It is a sign that waste and minerals are collecting in the bloodstream and irritating the nerves that lie beneath the skin. When the kidneys can no longer balance phosphorus properly, the excess starts combining with calcium to form tiny crystals that settle into the tissues. These crystals scrape against nerve endings and trigger histamine, the same chemical released during allergic reactions, which creates a deep, persistent urge to scratch. The back, arms, and legs are often affected first because these areas have higher numbers of sensory nerve endings. Studies from Johns Hopkins University show that the more phosphorus retained in the blood, the stronger and more frequent the itching becomes. To manage this, it helps to control the source rather than just treat the surface. Reducing foods that are high in phosphate, such as processed meats, cheese, and dark sodas, can lower irritation from the inside. Gentle cleansers without fragrance prevent extra dryness, and a thin layer of capsaicin cream, when used with medical guidance, can block itch signals sent to the brain. Light therapy has also been shown to help by calming inflammation in the skin cells and restoring balance in nerve response. Some specialists suggest adding small doses of activated charcoal under supervision because it binds toxins in the digestive tract before they reach the bloodstream. If you're finding this helpful, please take a quick moment to like this video. It may seem small, but it tells YouTube that this information about stage 3 and above kidney disease matters. That single click helps Kidnease reach more people who need guidance on skin symptoms and kidney care. Now we'll shift attention to a symptom that changes the way your skin looks rather than feels. It often gets mistaken for simple fatigue or aging, yet it actually reflects how the blood and pigments are altered when the kidneys weaken. It is the development of pale or yellow-tinted skin. When kidney function drops, the production of erythropoietin inside the kidneys slows down. This hormone signals the bone marrow to create new red blood cells, and when its level decreases, the blood becomes less oxygen-rich. As oxygen delivery to the skin declines, the natural rosy tone fades, giving the face and hands a pale appearance. At the same time, toxins such as urea and carotene that should have been filtered begin to build up, giving the skin a dull yellow hue. The body tries to push these wastes out through sweat and oil glands, which adds to the change in color. A study conducted at Harvard Medical School found that chronic kidney patients with low erythropoietin levels tend to have visible changes in skin tone long before their laboratory tests worsen. Iron and vitamin B12 deficiencies can make this problem more noticeable, as both nutrients are required to form healthy red blood cells. Increasing foods like spinach, lean beef, and fortified cereals can help improve these levels naturally. For some people, their nephrologist might suggest erythropoietin injections to help the body rebuild its red blood cell count. Avoiding excess beta-carotene supplements is also important because these can intensify the yellow appearance when kidneys are unable to filter pigments efficiently. Have you ever noticed your skin turning slightly yellow or pale even when you feel healthy and eat well? Share your experience in the comments because these small details can help others recognize early changes in their own bodies. Next, we continue with something that can change how your face looks in the mirror each morning. It might seem harmless at first, but it actually shows how the body is struggling to handle extra fluid. The next sign to understand is swelling and puffy skin. When swelling starts to appear in the hands, ankles, or under the eyes, it can feel confusing at first. Many people think it is just from standing too long or not sleeping well, but for those with stage 3 or higher kidney disease, swelling often signals that the kidneys are holding on to more sodium and water than the body can handle. As the kidneys lose their ability to filter waste, fluid begins to move into tissues instead of leaving through urine. This trapped fluid causes puffiness, especially in soft areas like the eyelids or around the feet. The skin in these areas may even feel tight or tender because the tissues are stretched from inside. Over time, this fluid buildup can slow blood flow, making the skin look pale and heavy. Research from Mayo Clinic has shown that consistent sodium reduction helps ease swelling and also helps lower blood pressure, which reduces extra strain on already weakened kidneys. The problem deepens when proteins such as albumin start leaking through the urine. Albumin normally helps maintain the balance of fluid between blood vessels and tissues. When its level drops, fluid escapes into surrounding tissues, worsening the puffiness. People sometimes notice that their socks leave deeper marks than usual or that their rings fit tighter by the evening. Have you ever noticed your shoes feeling snug even though your weight has not changed? That kind of swelling often reflects water retention linked with declining kidney function, rather than just diet or posture. Managing this requires careful attention. Reducing sodium intake below 1,500 milligrams each day helps the body release water naturally. Gentle leg elevation for 20 minutes daily allows gravity to help shift extra fluid back into circulation. Some people benefit from adding potassium-rich foods, such as spinach or avocado, but this should only be done if the doctor approves, because high potassium can be risky for kidney patients. Staying active with light walking also helps reduce fluid pooling and supports better circulation. Now we will take a closer look at a skin change that can appear suddenly and often shocks people who see it for the first time. It is something you can actually feel as a powdery layer on your skin. This condition is called uremic frost, and it shows that toxins have reached a dangerously high level in the body. When kidney function declines severely, urea, which is a waste product formed from protein breakdown, starts to build up in the bloodstream. The body then tries to get rid of it in another way, through sweat. As the sweat evaporates, the urea crystallizes and forms a fine white coating that looks like salt dust. This is not just a surface issue, it means the kidneys are struggling to clear even basic waste. People who develop this layer often describe their skin as dry, gritty, and uncomfortable. Sometimes it appears around the neck, forehead, or chest, where sweat glands are most active. It can even leave a faint ammonia smell on the skin because of the chemical composition of urea. The National Kidney Foundation reports that this symptom often appears during late stages of kidney failure, just before serious metabolic complications develop. Cleaning the skin gently with lukewarm water and mild soap can help remove the buildup. But the priority should always be medical attention. Scrubbing can damage the already sensitive skin and worsen irritation. Dialysis treatment usually becomes necessary at this point to remove the toxins that the kidneys can no longer handle. Patients are often advised to stay consistent with their dialysis schedule, since missing even one session can lead to a sharp increase in waste levels. The skin may clear temporarily after treatment, but it will reappear if the toxin load remains high. Every time this white layer forms, it is the body's desperate attempt to detoxify through the skin instead of the kidneys. Recognizing it early can prevent further complications and improve comfort for those already managing advanced kidney disease. Now let's turn our attention to a change that affects both appearance and confidence. A darkening of the skin that no lotion or treatment can easily fix. It is time to understand the cause of hyperpigmentation. When skin tone begins to darken unevenly or take on a grayish shade, it often signals more than just sun exposure or aging. For people with stage 3 or higher kidney disease, this discoloration can be a visible sign that toxins and hormones are no longer in balance. The kidneys play an important role in controlling hormone levels, including those that influence pigment production. When they start to fail, melanocyte-stimulating hormones increase, causing pigment cells to overproduce melanin. This extra melanin collects in certain areas, such as the face, neck, or arms, creating darker patches that slowly spread over time. Harvard Medical School dermatologists have observed that this excess melanin often connects with parathyroid hormone imbalance, which is common in kidney disease. This happens because the parathyroid glands try to compensate for disrupted calcium and phosphorus levels, indirectly stimulating pigment production in the skin. Toxins that stay in the bloodstream longer than normal also damage the skin's natural protective barrier. This makes the skin more sensitive to sunlight and more likely to darken, even with minimal exposure. Many people notice that no matter how much they scrub or apply brightening creams, the discoloration does not fade. The use of bleaching agents can actually make things worse, leading to inflammation and further pigment concentration. Using sunscreen with at least SPF 30 every day helps prevent additional darkening, even when indoors, because ultraviolet light still penetrates windows. Dermatologist-guided treatments like topical retinoids can also help by renewing the outer layer of skin and promoting cell turnover. Eating antioxidant-rich foods, such as berries and leafy greens, can support internal balance by reducing oxidative stress caused by waste buildup. Have you ever noticed darker patches forming on your skin even when you have not spent much time in the sun? These subtle shifts often carry early messages about internal imbalance, long before other symptoms become visible. Now we will shift focus from changes in skin tone to something far smaller, yet just as telling. The nails can act like small health records that reveal what is happening deep within the body. It is time to discuss white lines or nail ridges, also known as Muircher's lines. When the kidneys struggle to keep up with filtration, one of the first things affected is protein balance in the blood. The body depends on a key protein called albumin to transport nutrients and maintain proper fluid levels. As kidney filters weaken, albumin starts leaking into the urine instead of staying in circulation. Over time, this loss leads to visible changes in the nail bed, creating white lines or ridges that run parallel to the shape of the nail. These lines are not surface marks, but are caused by a drop in blood protein reaching the tissues under the nails. Researchers at the Cleveland Clinic have noted that the appearance of these lines often reflects prolonged protein deficiency and can serve as an early marker of declining kidney function. To address this, increasing high-quality protein from natural sources, such as egg whites, tofu, and Greek yogurt, can support better protein levels without overloading the kidneys. It is important, however, to avoid excess protein powders or supplements because they can create additional waste that weak kidneys struggle to filter. Regular monitoring of albumin levels through blood tests helps track whether protein loss is being controlled effectively. Sometimes doctors recommend specific medical diets that balance protein intake with kidney capacity, which can gradually reduce the visibility of these nail changes. The nail bed may take months to show improvement because new growth reflects long-term changes in nutrition and circulation. By paying attention to these subtle details, people can spot early signs of kidney stress before major symptoms appear. Moving forward, we will examine something that often confuses people because it looks like an allergic reaction, but actually points to deeper metabolic issues within the body, small red spots or rashes. Tiny red or purple dots that appear on the skin and do not fade when pressed are not just harmless spots. They can be a sign that your blood is not clotting as it should because of platelet dysfunction, which becomes common as kidney disease progresses. These spots, known as petechiae or purpura, often show up on the arms, legs, or around the eyes. They happen when tiny blood vessels called capillaries break and leak under the skin. In healthy kidneys, waste and toxins are filtered efficiently, which helps maintain the right chemical balance for blood cells to function properly. When filtration weakens, toxins accumulate and damage platelets, making them less effective in stopping small bleeds. Stanford University Medical Center has found that kidney patients often experience a shorter platelet lifespan, leading to these microbleeds that show up as red or purple patches. Even mild cases of these spots should not be ignored because they can point to both poor blood quality and advanced metabolic imbalance. Nonsteroidal anti-inflammatory drugs, often used for pain, can make this worse because they further interfere with platelet activity and reduce kidney blood flow. It is better to discuss pain relief alternatives that are safer for kidney function. Adding foods rich in vitamin K, such as broccoli, kale, and spinach, can help strengthen the body's clotting ability naturally. Keeping dialysis sessions consistent is also important because skipping them allows waste to accumulate again, making the bleeding risk higher. Sometimes these red spots fade slowly once the underlying toxin levels improve, but consistent management is key. Have you ever noticed small spots on your skin that did not go away even after a few days? These small marks may carry more meaning than most people realize, especially when kidney function is already under strain. Now we will take a closer look at a symptom that is often overlooked because many people mistake it for seasonal dryness or stress-related shedding. It is actually one of the clearest signs that waste buildup and hormonal imbalance are affecting circulation and nutrition. This next concern is itchy scalp and hair loss. When kidney function declines, toxins that should have been filtered begin to circulate throughout the body and eventually reach the scalp. These toxins disrupt normal follicle cycles, which leads to thinner hair and increased shedding. At the same time, nutrient absorption in the gut becomes less efficient, especially for minerals like iron and zinc that support hair growth. The scalp's natural oil production also changes, leaving it dry and itchy. Increased levels of stress hormones such as cortisol further damage follicles, pushing hair into a resting phase instead of allowing it to grow. This combination of poor blood quality, hormonal disruption, and nutrient deficiency creates the perfect environment for hair loss. Research from the University of Michigan Department of Dermatology has shown that improving scalp circulation with topical vitamin E can enhance blood flow and promote healthier follicles in people with kidney disease. Choosing gentle care can make a big difference. Using sulfate-free shampoos with zinc pyrithione helps reduce irritation and supports scalp health without removing essential oils. Massaging the scalp with jojoba oil or coconut oil boosts blood flow to hair roots and helps soothe dryness caused by toxin buildup. Eating foods rich in biotin and iron, such as oats, spinach, and eggs, nourishes the follicles from the inside. Staying consistent with kidney treatments is just as important because uncontrolled waste levels will always show first through skin and hair changes. A healthy scalp often reflects balanced internal function, so paying attention to these small signs can provide early clues about overall kidney stability. Before we wrap up, we will move beyond these symptoms to discuss one powerful habit that helps detoxify the body, improves circulation, and reduces skin discomfort caused by kidney overload. It is called dry brushing therapy. Dry brushing therapy may sound simple, but it has a powerful effect on the body's natural cleansing process, especially for people with stage 3 or higher kidney disease. When the kidneys are not filtering waste effectively, the skin becomes the body's secondary detox pathway. Dry brushing works by gently stimulating the lymphatic system, which helps carry waste fluids away from tissues and back into circulation for removal. The lymph system has no central pump like the heart, so it depends on physical movement and stimulation to keep fluids flowing. This technique encourages lymph drainage, which can reduce toxin buildup in the skin layers and lessen inflammation that often leads to itching and dullness. Using a natural bristle brush with medium firmness is best because synthetic fibers can irritate sensitive skin. The brushing should always move toward the heart to support the body's natural circulation pattern. Starting from the ankles and moving upward helps activate blood flow through the legs, which are common areas for fluid retention in kidney patients. Doing this for just 5 to 10 minutes before showering 3 to 4 times per week can gradually improve skin texture and tone. Research from University of Wisconsin Health found that lymphatic activation techniques like dry brushing increase skin cell turnover and support toxin elimination in individuals with limited kidney function. The process not only boosts blood flow but also helps reduce puffiness caused by water retention. After brushing, it is important to apply a fragrance-free moisturizer to lock in hydration and protect the skin barrier. Overbrushing should be avoided because it can irritate the skin or cause small scratches that increase infection risk. Gentle and consistent strokes are far more effective than strong pressure. Have you ever tried any type of lymphatic massage or brushing technique before? Many people report that it helps them feel lighter and more energized, which makes sense since it aids in circulation and detoxification. Now that you understand what your skin is signaling and how simple habits can support kidney health, it is time to quickly recap all the signs and their meanings for your kidneys. Dryness and flaking show early moisture loss caused by toxin buildup. Chronic itching comes from phosphate and toxin irritation. Pale or yellow tone signals anemia and urea pigments. Swelling points to sodium and water retention. Uremic frost shows severe toxin excretion. Hyperpigmentation reflects hormonal and waste imbalance. Nail lines indicate low protein levels. Red spots mean platelet dysfunction. Hair loss results from hormonal and nutrient deficiency. The bonus tip, dry brushing, helps detoxification and circulation. Each of these skin changes tells a story about your kidneys, so noticing them early gives you the power to act wisely. If this video helped, subscribe to Kidnease. We focus only on stage 3 and above kidney disease. Type relief in the comments if you learned something that truly helped you.